So thank you everyone for joining this morning. My name is Christy Strauss. I'm the VP of Sales at IAD. I appreciate you taking time to learn about our newest carrier partner this year, Trinity Health, very big organization. I know down in the southeast part of the state, we see a big presence now with IHA have teamed up with Trinity Health. So there's a lot of different Trinity Health clinics or hospitals in our area. I'm sure it's pretty much the same on the west side of the state. But we're going to learn a lot more about the plan offerings, and we're really excited to be part of this. So thanks, guys, for...
No, thank you very much. I appreciate the introduction. Again, my name is Dan Trombley. I'm the manager of agent relations for all 6 states that Trinity is operating in. And Nathan Worth is our broker account executive in the state of Michigan. Nathan, where are you located in Michigan, so everybody knows?
Sure. I am just west of Lansing, so I'm kind of right in the middle, so I can reach both sides of you guys on each side of the state. I'm happy to meet and introduce myself pretty soon. We will be at the broker seminars next week, on September 27th. We'll be at the JW Marriott in Grand Rapids at noon. And then on the 28th, we'll be in Grand Haven at the Holiday Inn Spring Lake location. That'll also be at noon. So if you do have the opportunity to meet us in person, we'll be there. I'll be happy to see you.
No, that'd be great. Thank you very much, Nathan. Go ahead, Kirsty.
Will you be having any of those on the east side of the state?
We have had a few different ones on the east side of the state. We will not have any more on the east side before AEP.
Okay, gotcha.
If anybody needs kind of a one-off, we are happy to do those virtually.
Okay.
Or if anybody needs to see somebody in person, Nathan can make that trip as well.
Okay.
Yep.
All right, so give me just a second. I am trying to open this presentation right now.
Okay.
And I love technology when it works, and I can't stand it when it doesn't. So
we all do.
Yes.
It's so wonderful when it's working.
We're a new entry into the Medicare Advantage space in the state of Michigan for 2024. We chose to enter there because that is our company headquarters. Trinity is located in Michigan, and that's the company headquarters. And we're quite honestly and selfishly, we're looking to take advantage of name recognition. Promoter score there is over 70, actually over 80. So it's a very well recognized name. So I am going to share my screen now. All right, Christy, can you let me know when you see that?
I will. Awesome. I see it.
Okay, cool. This is what's to know about us. Nobody really cares about this stuff, but I have to put it in there as well. We started in 1997. Why that is important is we're a Medicare Advantage only shop. We don't do subs, we don't do employer group, we just do MA, and we do it very well. You're going to see in a few slides that we're a 4.5-star rated plan in the states of Iowa and Ohio, riding on that paper going into Michigan. But where it's important for you is we've got about 47,000 Medicare Advantage beneficiaries in these 5 states that you see at the second to left bullet point. We just launched in Connecticut for 2023, and we're expanding to Michigan for 2024. So that's kind of who we are, what we do. Really what you're going to want to care about is going to be our service area. 6 counties. We are not overthinking this. We are not trying to overshoot. We are strategically going in where Trinity has the best name recognition. And we have the strongest network, to be honest with you. Those 6 counties right there. Why to contract with us? Here's kind of the plan highlights. We have a full MAPD plan that's got $150 cash back every month, or $1,800 a year. We also have an MA only plan that is $100 of cash back per month. We have a flex card right there. You're going to see approximately $500. It is $1,000 on the MAPDs. It's $500 cash back on the MA only. We've got, dental we'll talk about in just a second. Just so everybody realizes, we use the United Healthcare Dental Network. It's private labeled to Dental Health Partners. Nobody knows who that is, but if you say United Healthcare, everybody.
Did we lose you?
Yeah, I think we might have lost Dan there. So let me just pick up where he was at there.
Okay.
Yeah, so he had mentioned United Healthcare for dental there. That's going to use their networks there. We have an embedded $1,000 of combined maximum and preventative dental there. There will be optional buy-ups, and we'll get to that towards the end. Looks like we might have lost him here. We also offer a lot of the options that you'll see have become pretty routine. Silver sneakers for your gym memberships. We have a 24-hour nurse line, as well as a telecare as well. One thing that we do offer that you don't see too often is acupuncture. That is going to be offered for 12 visits for the HMO, no premium, and the MA only. And then you will also have 6 visits for the MAPD cashback. And let me see.
Why represent us? I mentioned a minute ago, 4.5-star plan rating. So high quality scores, high HEDIS scores, high CMS plan rating score 4.5 in Ohio and Michigan. I'm sorry, Ohio and Iowa.
We might need you to share your screen again. It looks like it stopped sharing the presentation.
Thank you so much. I appreciate that. I don't know why, but it stopped sharing, and I love technology. And sharing now. Can you tell me if you see it?
Got it.
We're good there, Dan.
Got it. Thank you, guys. So why sell us? This is the 4.5-star plan rating, high quality scores, high HEDIS ratings, which means less problems for you as an agent and more satisfaction for your members. The next slide is actually my favorite slide. The bottom right is my favorite statement in this entire slide deck. One member is 110 years old. She's been with us since 1997. The God's honest truth, she made the plan. She's in Ohio. She made a plan change last year to the cashback plan. And last year, 2023, the cashback was $50. And she wanted to get $50 a month back in her Social Security check. So either she's fairly spry or she had somebody managing her account, which either way I think is great. The number, the top left, I'm going to switch to. Our normal member stays with us for about 8 years. What does that mean for you? You have to switch them less. You have less customer service issues. The oldest member is 26 years. That in the MA space is ridiculous. We have 155 members that have stayed with us since 1997. So I like this slide because it shows an accurate depiction of our membership, who likes us, why they like us, and how long they've been with us, which translates to an agent as I don't have to do a lot once I place this person with this carrier. And that's our whole goal, make it easier for you. The next slide is going to talk about claims performance and why this matters to you. So you will see in the third box over, 99% of our claims are paid accurately. The most frustrating thing is when a claim is submitted, it's missing a modifier, most likely a modifier 26. But 99% of our claims are paid on time or early, which is 30 days, prompt pay is 45, and they are paid accurately. So 99.8% of our claims, the first box, those claims are paid within 30 days. What does that mean to you as an agent? That the client is never going to receive a bill from that provider because we pay them before prompt pay kicks in. Excuse me. So It just kind of goes to show our commitment to excellence with members and our commitment to excellence with brokers. Now, we're fairly new to the broker game. In Michigan, obviously, year one. We started brokering our product in 2019. So we're new to this, but we're not new to the MA space. And then we'll go to provider network. We put this slide in here to show you scale. What you see here, Ohio is our backyard. That's where we started. That's where we've been since 1997. But what you will see in Michigan is what we have been able to do. And this is kind of an ever-evolving slide. The numbers will change daily. This slide deck was updated, I think, about a month ago. So you see the numbers represented about a month ago. It shows our commitment to the area, and it shows our commitment to the state of Michigan. And then we're going to show competitive plan models. We talked about the $150 cash back. That's a monthly thing on the MAPD, $100 on the MA only. We talked about the CVS Caremark formulary being the core formulary. Tiers 1 and 2 for mail order, those are going to be $0. Tier 1 medications are going to be covered at $0 through the coverage gap. You got to have that if you want to play in the space. The hearing is included through True Hearing, and again, those copays are $5.99 and $8.99. Dental and vision. It's important to remember that that network is actually United Healthcare. The vision network is labeled Spectera, which is United Healthcare's private label network. And then Dental Health Partners is the dental plan, but that is also United Healthcare. I know it's somewhat confusing, but that's why I keep bringing it up. No referrals when seeking in-network specialist. We talked about that a second ago. That was done away with in 2011. As long as you see an in-network participating provider, there is no referral needed. If you cannot find the provider listed on our website, your first call is to Nathan. Nathan is able to look that provider up in our back-end system. A lot of you have worked with other carriers who have quote-unquote back-end systems. Nathan has that access as well, so do I. So if Nathan is not able to help you, he can reach out to me, or you can reach out to me as well, and we can look for those providers in the back-end system. Some providers that we have are listed as do not publish, meaning they're participating with us, but they do not want to be published in any provider directory, including online. So the other benefit that we have is there's no copay stacking. We talked about that a second ago. If you have 3 services in one day, primary care, physician visit, a lab, and a CT scan, you're going to pay the higher of the 3 copays. You're not going to be billed for all 3 copays, which is a differentiator in the market. So that's one thing that we try to make sure that we are member-centric. We try to make sure that we do things for members that is member-friendly. The second to last slide here, actually, no, I'm going to go to this slide. Here's what everybody really wants to see. Here's your top 5, top 7 benefits that you're interested in for your members and your clients. So the HMO no premium plan, $0, no Part B give back, lowest MOOP. You'll see the HMO cashback MA only. I've talked about that a few times, $100, and the MOOP is $5,500. You'll see an HMO cashback MAPD plan. It's $150 with a $6,500 MOOP. Obviously going to have the largest inpatient and outpatient copays respectively. You'll see the Part D drug deductibles down here. The one I mentioned right here is highlighted in I can't highlight it. So the HMO cashback plan, the MAPD plan, is going to be a $300 tiers 3, 4, and 5. And again, most of our prescriptions that are dispensed, 93% are tier 1 and tier 2. So most likely your clients will not even experience a deductible. We'll go to the next one here. You'll
Dan,
see.
before you go too far, could you go back one slide? I don't know with the cutoff. Could you explain how the pharmacy networks work real quick?
Yeah, thank you, Nathan. So we don't have, like some other carriers do, we don't have a primary and secondary network or preferred, non-preferred. If they participate with CVS Caremark, they're in our network, and the client is going to experience preferred pricing. The network of providers that we have in the Caremark formulary is about 66,000. Nathan, did that help?
It did, yeah. And I'd just like to mention one other thing. You will see down at the bottom of the mail order for a 90-day supply, you will see for both the MAPD cashback and the no premium HMO that they are both $0 for tiers 1 and 2. But then you will also notice that instead of 3 times the copay cost for that 90-day supply, it is only 2 times the cost.
Great point. Thank you very much, Nathan. I'm going to go forward to the vision and hearing benefit. Vision is Spectera. Again, United Healthcare, you see your vision benefits right there. You've got a $225 allowance on the $0 premium and the cashback plan. I'm sorry, the MA only plan. The cashback is $125. The true hearing benefit, you'll see there $599, $899. Acupuncture is actually administered through Trinity Health, which is the parent company of Silver Sneakers. So you'll see your acupuncture benefit there. You also see your CVS Caremark OTCHS OTC benefit, which is a quarterly benefit. It does not carry over. Make sure that your clients use this early and often. You'll see a flex card benefit. The flex card benefit ranges from $500 to $1,000. That flex card is good for vision and hearing benefits only. So they can't use it for dental or anything. It's vision and hearing only. We want to make sure that we cover those costs for the people, that make sure that they get the benefits that they need. The travel allowance, you'll see at the bottom, that is an interesting benefit and somewhat unique to us. Your client will simply call our member services in Columbus, Ohio. Again, no IVR, no pressing a button. They call Columbus, they're going to talk to Dan. When they call Columbus, Dan says, hey, this is Dan, member services, how can I help you? Hey, this is Joe, I'm going to be traveling to Florida. They're going to be having physical therapy as they had their knee replaced the day after Christmas. I don't know why anybody would do that, but they would do it the day after Christmas, and they would want to rehab in the warm sunshine weather where I would want to rehab. That benefit that you see there, $3,500 and $1,500, the plans are respective, of course, that goes towards their move. So if they need to go to physical therapy, whatever their physical therapy benefit is, $25, $30, $35 copay, that goes towards their move, and the provider bills us and we pay as a network up until that dollar amount is met, which is a really important thing for your clients to know, that they do have out of state coverage, not out of county. So when they're traveling out of the state, all they have to do is contact our member service department in Columbus and activate that benefit. So here we have dental. We've talked about dental a few different times. Here's your standard embedded dental on the top line in the gray box. If your client wants to increase dental, they can go to the silver or the gold. The silver will be $16 a month. The gold is $41 a month. It increases the dental amount by $500 and $1,000 respectively. But there you see your percent, or their percentage of co-insurance, what they have to pay. It is not a first dollar payer. So that's one of the things that you have to make sure that you talk about with your clients. And now I will show you our director of sales. He is our national director of sales in all states that Trinity operates. This is Travis Dews. That is his email address. That is his phone number. You can call and text him at any time you want to. The next one is me. That's my email and that's my cell phone. You can call me or text me anytime you want. And the last one, excuse me, the last one is Nathan. He is our newest broker account executive in the state of Michigan. He is residing in Michigan, and he is your first point of contact for all things Trinity Health Plan of Michigan. So with that, I said before when we started, I will run through this quickly because it's not a lot of information, but I'd like to get to the questions and answers. So that said, anybody have any questions?
So I'm looking right now in our Q&A and our chat feature, and I'm not seeing any questions. So either you guys did a really good job or
I must be the
everybody's
best
just
presenter ever.
yeah. Oh, wait a minute. So what is tier 1 copay if they go to retail pharmacy? Is it still the 0?
It is 0. We don't have a preferred and non-preferred pharmacy copay. So if they go to a participating pharmacy, tier 1 copay is going to be 0 on all plans.
So like Meyer, that's a participating pharmacy. I mean, do you have a list of participating pharmacies?
I don't have it with me, but I can get that for you.
Okay. Sounds good.
And they're all, I mean, it's a wide swath of pharmacies, all the big box stores, all the specialties like Costco and Sam's Club. You'll find Kroger, Meyer, then your CVS's, all that. They are pretty extensive in who covers, and it is due to that standard rate as a coverage that we are not playing favorites on who's preferred, who's standard.
Gotcha.
And that's kind of the reason that I hit on the core formulary a couple different times. That is the most robust formulary that they have and the most robust network that they have.
Okay. So a couple more questions. When will this come to the Oakland, Macomb, and Wayne County area?
I love that question because I got that question at an event I was at a few weeks ago. 2025. That is on the drawing board for 2025.
Okay.
And truly the reason is, if you look at those 3 counties specifically and who our partners are on the payer side, we agreed not to come in their backyard year 1.
Gotcha.
So it was kind of a reciprocity.
Yeah. Okay. And then another question. So using full flex, what is the cost of hearing aids? So if that flex card's just for hearing and vision.
Yep. So if the flex card is for hearing and vision and it's $1,000 flex card, they could use $1,000 towards the $899 hearing aid per ear benefit. Meaning they could cover the $899 and then the $100 remaining for ear 2. If they wanted to use it for vision, they could cover any cost of the vision exam, any cost of the vision allowance. So I'm going to make this up because it's stupid. So say somebody wants to get some Armani frames that are going to cost, $1,000.
Okay.
They could use that flex card towards that $1,000 of the Armani frames.
Gotcha. That makes sense. And then did you go over commissions? I don't think we did talk about that. Are you paying the full CMS?
We're going to pay $1 per application. I'm just kidding. That was meant to make everybody laugh. So we do pay full Medicare commissions. I never talk about commissions because different FMOs are different, and some people, their FMOs own their book of business and they get paid a lesser amount. But we do pay the full CMS commissions for 2024. Yes.
Okay, perfect.
And that was due to CMS by the end of July of this year.
Right. Okay. All right. Well, that is great. Any more questions? I think that is all we have on the questions.
I'm going to go back real quick if you don't mind.
Yeah.
And I'm going to put Nathan's information up on the screen real quick. Nathan, sorry to do that to you.
Okay. Perfect.
This is Nathan's contact information. Any
Right.
questions, comments, or concerns that you have from this specific conversation or something that we didn't go over, email Nathan. He'll be happy to get back with you immediately.
That's great to know.
Yeah, it's something that is a differentiator for us because Nathan is on the ground and he does get back to you very quickly.
Perfect.
Yep.
Well, thanks, guys. We
Yeah.
really appreciate this. It's a nice way to get started. Anybody on the call that wants to go ahead and get contracted, please do contact me. You can call the 800 number, which is 800-381-0977, and ask for the contracting team or extension 119, which is my extension, and we'll get you appointed directly. So you all have your certification ready for agents that once they get contract, they can just delve right into certification. Is that correct?
One more thing on certifications.
Okay.
Our certification process should take you approximately 20 minutes end to end.
Okay.
We use the Miramar system. You will
Okay.
have a key that you will enter when you register a new program. For those of you familiar with Miramar, you enter a new key every year. It takes 20 minutes and there is no test. You do have unfortunately, a 34 slide deck presentation that you have to sit through. I'm sorry that I created that and I apologize, but it's 34 slides. It takes about 5 minutes. And after you attest that you watched that, it will take 48 hours for you to get appointed to go through the different appointing state entities.
Perfect. And you accept the AHIP, correct?
Absolutely. Yep.
Okay. Very good.
Yeah. Are there any other questions that you have for me and or Nathan?
Corewell is in network, yes.
Corewell is in network. Okay.
They are in
So
network.
Corewell, formerly Spectrum and Beaumont, we did get confirmation that they are in network.
Correct.
Great. That's good.
Yeah. All right.
All
Well,
right. Well,
thank you very
gentlemen,
much for your time. I appreciate it.
yes. And thank you all, our agents that participated in this. I hope you found it helpful, and we will get back to you.
All right. Thank you so much for your help. I appreciate it.
Thank you.